Join us as we dive into the must-know health secrets that medical experts won't tell you.
These health secrets are being kept under wraps, and we are about to spill the beans on what the experts don't want you to
No,
know.
no, they don't. There's only one option they give. Well, two: surgery or medication, right?
Yeah. 1.6%. So that means that if I don't take the drug, I still have a 98.4% chance of not having a heart attack
Whoa, people are sick, overweight.
because of your mother and father's genetics. And there's nothing you can do about it.
That's not true.
No, you can prevent many diseases and chronic illness by simple lifestyle. Did you know that almost 80% of chronic diseases are preventable with simple lifestyle changes? Well, it's time to take back control of your health. Because if you look everywhere, what do you see?
People are sick, overweight, sick, overweight.
Or you look around, there's more heart issues happening,
Yes, cancers.
dementia,
Yes,
nerve problems are going through the
skin
roof.
problems,
And there's things out there that,
neurological.
yeah, they make things up that I never even heard before. One of my employees said that she was diagnosed with claustrophobic anemia.
Huh? What's that?
I have no idea.
Does she know what that is?
No, I don't think the doctor knew what it was, but some kind of diagnosis out there that they can throw out there. It's crazy, but that you look all around from family and friends and just the general public, you just see more and more health issues.
That's sad.
Very, very
That's
sad.
sad. A lot of people, the young people. I know of one person, young, pretty young, and they can't figure out what's wrong with her. Losing a lot of weight, but they can't figure out what's wrong with her
Oh, yeah.
at all.
And that's kind of the theme when it comes to the medical industry is if you know that you don't feel well and something's going on and yet you go in and everything's everything looks good.
Yeah, everything looks good.
It's mental. It's something else going on here.
Yeah.
And so that's a great way to lead into it. And when they are able to diagnose something, like the first thing that they don't want you to know is that medicines don't cure the problem. They only heal the root cause
Yeah.
at all.
It just masks it, or it addresses the symptoms to keep you comfortable, right? Basically.
That's what it is. Yeah. So you go in, get a blood test, and they say, oh my gosh, you have high cholesterol. So let's give you a statin drug to manage that marker or that number to bring it down. And that's not healthcare. That's just trying to manage different numbers in the range that you think is good to say, oh yeah, look, now you're healthy, but you're on a medicine.
Right.
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 Can you think about like a cholesterol drug? Here's the deal. Like Lipitor, if you take Lipitor, you basically have a 1.4, 1.6% reduction in having a significant event, meaning a heart attack. 1.6%. So that means that if I don't take the statin drug, I still have a 98.4% chance of not having a heart attack.
Wow.
So that's not really statistically significant in order to take.
Yeah.
Right? And if I take it, they're really making a meaningful difference in my life.
Yeah, and all the side effects that come with these medications too, right? I remember some years ago during the C19 debacle, I remember it was just stress from everything, and I was very anxious when my kids had to go back to school and the whole nonsense that went with it, and I couldn't sleep. And I remember because I wasn't sleeping at all. I started having anxiety. But my point is, it's like instead of trying to figure out what the problem was, the doctor said, "Oh, well, I have some sleep medication here for you that you can take." And it's like, well, why I'm not sleeping? But I didn't make the connection at the time that it was stress that was keeping me up, worrying over silly little things.
There's always a root cause.
There was always a root cause. That was the root cause. I was stressed out. So it had I taken that medication, I would have had a ton of other side effects, right? And then you get on that.
The cycle. You got to manage something else. And that's exactly what it is. See, the thing, they call it the practice of medicine, the practice of dentistry. And the number two thing in which they want you to know is that they're practicing medicine on you, right? Like your doctor, like
Yeah.
throwing meds at you.
Yeah.
Right.
Practicing to see what sticks, right? Yeah.
Yeah. So let's see if it helps. Oh, yeah, it helps. Oh, no, let's give it a little bit more, a little bit less.
Yeah, because if you're still not sleeping, oh, let me dial it up.
Yep. Yep, yep. And if not, then let's go ahead and run a test. And if that test don't say anything, let's run some more tests, more tests, more tests, more tests. And you don't get answers at all.
Yeah.
And then the practice of medicine.
Yeah. That's because they're practicing, like you said,
Practicing
to
all.
see what works.
Yeah, yeah.
Yeah. And if you have side effects, we got something for that too.
More tests, more drugs.
Yeah.
Yeah. Because at the end of the day, I guess the third thing is that the medical industry, it's a business.
That I had to, when I looked at it from that framework, it really blew my mind. It's like, you're right. This is not philanthropy.
You can't do it for free.
No.
Yeah, it costs money, and then if you're a business that is operating it, you got to have a profit in order to be around. Because if you're not around, then you're not going to be able to provide any kind of service. And so the incentive is the profit. The incentive is not a positive outcome, because if everybody was healthy, they wouldn't be in business.
People wouldn't come to them.
Yeah, 100%. And the way I like to look at it, like the hospitals, it's the same thing as a hotel. You got to have
Butts and beds.
butts and beds.
Yeah.
The more butts and beds you have,
The more procedures.
the more procedures,
Yeah.
more money,
Yeah. The
more
money for
reimbursement from
them.
insurance. Yeah.
Yeah.
And that's what happens. And so they have this great model that you don't even think of. Hey, let's go get a test, right? Oh, here's another intervention. It could be a poison pill. It could be a mutilating surgery. It could be radiation that just tears everything up. And you want some more tests? Oh, there's still some things wrong. So
Yep.
let's refer you.
Yep. I've known people who have had surgery, whether it's on their knees or their ankles, their foot, whatever. And it's like, well, that didn't work, so we're going to have to go back in there. Or you have people who, whether they broke their ankle or their foot and they're not healing properly. And it's like the first thing that comes to their mind is surgery.
Yeah, it's crazy. I'm not okay with it for myself.
No.
You know, the question is, are you okay with it? There's a newer full body MRI machine called Pronuvo, and it can be anywhere from $1,000 to $25 for the full body scan. And here's what they promise: they can actually seek out and find about 500 different medical conditions. And so, if you're doing this scan, you're looking for a problem.
Yeah.
You're feeling fine.
Yeah.
But then, through the scan, let's see what's kind of happening. We found these 10 things. What are they going to do with those 10 things?
Well, we can get you started on these medications because we want to save your life. And so glad we found it early because we nip it in the bud early.
Right, right. Which leads to the fourth thing is that there's this big conception that early detection saves lives all the time. And that is just not true. I don't know why they keep saying that. They have their reasons, but
slogan.
I'm here to tell you it's
They're
not
selling
true.
it. They're selling it.
Oh, completely selling it.
Yeah.
Because you take like mammograms.
Yeah.
We're being sold that mammograms you got to do every year or two.
Every year.
Because they find thing it's a lifesaver. And it's going to be controversial.
Yeah. And they tell you to start early to get your baseline at 35 years old.
There you go.
And then from when you turn 40, you
They
start
can-
getting it every year. That's
So-
a lot of radiation.
So it's a lot of ratio. And here's the thing. With mammograms, you're 3 times more likely to be overdiagnosed than it is to actually save someone's lives. And so now you're talking about saving lives. So what we found someone who is diagnosed with cancer and they're totally fine within 5 years. So guess what? There's 3 people's lives that we saved. So early detection saves lives.
Wow.
But they had a problem they didn't have a problem to begin with.
Wow.
It could have resolved itself.
So, right. What's another one?
I'll say a colonoscopy
Ooh, that's another big one.
because
Get your when you turn 50, get your colonoscopy.
right. And here's what they don't tell you is that for about every 1,000 colonoscopies, 1 life can be saved.
One.
1 life can be saved. But they don't tell you that 1 death also happens from the perforations and complications of having a colonoscopy. So it's a net zero, 100% net zero.
Wow.
So me personally, I'm doing things that I don't need a colonoscopy by having my lifestyle, nutrition,
Yes. You're doing everything which you're supposed to
supposed to do.
live
And
naturally and clean.
yep. And even if I were to get cancer, I'm not going through it. I'm going to do everything I can, even more naturally and more
Yeah.
holistic, because I don't want to live with those complications from the
Yeah.
medications and treatment interventions.
Right.
But then again, it got all those procedures, all these interventions, and this profit model. So they're going to get compensated. And the way, part of the way hospitals and doctors get compensated is, so the fifth thing is that their compensation is based upon your compliance.
Explain.
So when your compliance is, if I'm a doctor, I tell you, here are my orders. Just take this medicine, to do this vaccine, to do this schedule, to take whatever it may be. My orders is that as a patient,
You should listen.
you get rated upon if you're compliant with my orders or not.
Oh,
And so if I have 100 patients and 95 listen to me and do what I say, I have a 95%
compliance rate.
compliance rate.
Is
Well,
that by the is that by the insurance companies?
everybody knows that number. They're measuring it. And so insurance companies want to make sure that you are 100% compliant, because if you're compliant with, say, doing a medicine in which they're going to have on their schedule, in which they have in their benefits management type of group, then they can get kickbacks from the pharmacy as a form of rebates. And so if you're compliant, then that means, hey, I'm going to get my rebate. But if you're not compliant, you're not at a high percentage, then guess what?
They don't get anything from you.
You don't get anything from me. So for the people who are not compliant, they start to weed them out of the practice. In fact, it happens to us.
Yeah, that did. Now that you mention it, it did. For their annual physicals.
Our kids?
Yeah.
Yeah. Explain yourself, sweetheart.
We had to, because of their activities. They need to see that physical, that sports physical. And because we opted to not do certain medications,
The V's, no more V's in the kids.
I feel like they've had enough.
Yeah,
It's not like they don't have any. They have had enough.
plenty.
And because of that, I was told that I couldn't bring them back there. Future care.
Yeah. You're no longer wanted here, can't be accepted here because you're refusing to go with the orders. Okay, I got it. In fact, I think that doctor even called back to ask you certain questions to help clarify the notes that they were documented in the files there.
Yeah. So,
You know.
yeah.
Which again, number 6 thing they don't want you to know is that, like, if you were to try to get those records, it'd be,
I can't get those records now, even if I wanted to.
be very, very difficult.
They'll make it so hard.
Yep.
Yeah.
So it's the red tape. It's what they want to give you, but also too, it's the government's behind it as well with all the HIPAA laws. They make it very difficult to release records because and it's part good because you don't want to, hey, I need my records, and you send somewhere without any knowledge because that's my information. But it's very difficult to request it, go through the process and all the red tape just to get it. So it's not as simple as 1, 2, 3 and a phone call.
Right.
Right.
Right. Which shouldn't give you pause, right? It's your records that you paid for because you went to the doctor and you paid for it, right? And it's
Yeah.
your information, your body,
Yeah. You should be able to see, the diagnosis,
everything.
the risk benefits, the different treatment options of what was talked about, etc.
Don't you have, like, I guess now you can go online and see your stuff.
It's limited stuff. You got some things, but
Limited.
it's limited.
Oh, I didn't realize it's limited.
Yeah, I mean, even as a doctor, you have complete. It's like having it's a business, and so you have like almost like a CRM. So any kind of conversation I'm having on the phone, email, whatever, I'm logging all that communication. If you ask for records, you're not getting that.
That part of it.
That part of it. Then you have the billing section. Then you have the account section. Then you have the clinical notes section. Then you have the diagnosis section and the treatment section and the pharmacy. So you got all this stuff that makes up a complete record. So when you ask for it, you don't get all of that. You got X-rays and results, referral letters. It's a big mess. So to get your complete record, it's very, very difficult to do.
Yeah.
Now the best thing is to stay out the medical system, really.
All right.
And so, speaking of the records, and you go see doctors, is that they don't give you many options for treatment.
No, they don't. There's only one option they give. Well, 2. Surgery or medication, right?
Yeah.
That's it.
For the most part.
Yeah, that's it.
They don't inform you of the risk benefits, how significant of an impact it would have on your life. They don't tell you about the risk reduction of the outcome they're trying to prevent.
Wow.
Because one, a lot of them just don't know, and number 2, they're not incentivized to do so because you can reverse heart disease naturally.
Right.
But there's no incentive for a doctor to say so. In fact, there's pressure on doctors to make sure they intervene and do the surgical procedure.
Yeah.
Right. Hence the compliance again.
Right.
And a lot of times, so a lot of times, And I'm talking a lot this one. I'm all pumped up.
That's fine because this is more your thing that you know better than I do.
Yeah,
You're
yeah.
medically trained. I'm not.
Well, if I'm talking too much, she can just let me be quiet. But how many times do you hear it? That oh well, you have high blood pressure because of your mother and father's genetics, and
That's
there's
not.
nothing you can do about it.
That's not true.
That is 100% not true at all. There's different genes. So the genes like my light brown skin, those are it's always on. If the sun hits it, I get darker. No sun, it goes down. That's always on. However, the expression of type of lack of or diseases or other systems that can take place, those genes do not have to be expressed or turned on.
Well, it's your lifestyle, right? That turns it on.
Lifestyle, different chemicals, exactly,
Wow.
exactly.
Okay.
So yes, and so you just got to know that there's some things you can do about it, and just the fact that everything looks good in blood work or genetics, and the only way to take care of a high blood pressure, the high blood pressure pill, that's just not true.
That's not true.
Not true.
And a lot of, like you said, a lot of the doctors don't even know, or they don't want you to know. But the majority of them probably don't know
Yeah.
because they was trained X, Y, Z, and that's it. Don't ask why. Don't ask how. Just X, Y, Z. You repeat after me.
Yeah.
So
Yeah. Because my great grandma has nothing to do with how well I take care of my body.
right,
I had no idea, not at all.
right,
Right. Yeah, and you bring up a good point. The doctors are trained in this system,
yeah.
and it's not so much that they're bad people. The doctors are not
They're
the
not.
problem of,
They're
of
not.
this. They're just
They incentivized to be like that.
yeah, and they've been indoctrinated, and it takes a lot to open your eyes and hold on here. This don't make sense. Let me learn some different things, and you start learning different things. You say, wow. And one of the things I learned, which is number 8, which I want to let you know, is that the FDA is not for your protection at all, because 50% of its budget is funded by big pharma.
Wow. Wow.
So
You
think
went
about what
there.
that means.
That means they don't have your best interest at heart. They
Yeah.
have somebody else's interest at heart. They have to look out for.
If I'm the FDA and I start ruling against big pharma and not putting the suggested things that they want to put into the or declare safe, I'm not going to see that 50% of that budget.
But I've heard from people who have worked for Big Pharma saying that, well, we can't put out a product if it's not approved by the FDA, and we have to go through all these stringent practices and pra- things to do to get it approved.
That's 100% true. Yeah.
So they still have to play that song and dance with them, even though Big Pharma donates 50, give them 50% of their budget.
They donate it, and yes, they got to do the song and dance. And at the end of the
Is
day,
that just theater?
it's theater. It's produced, right? And you give this whole aura that I'm the FDA, and then we approve stuff, and it's safe and effective.
No, I'm saying if so. For example, if from what I was told that this person worked for for a particular pharmaceutical company,
Yeah.
and they had this one product they wanted to bring out to the market, but the FDA wouldn't approve it initially because X, Y, and Z. They told them that they needed to have X, Y, and Z done.
Gotcha.
So I'm asking, you think that was all theater because the FDA knew they were going to approve it, but was that all theater to just show that hey, we're still in control?
Yeah, probably a little bit of theater there as well. There could be some politics involved, depending on what kind of a company, who knows who knows what,
Right.
because all those guys know everybody.
Okay.
Yeah, I mean, there's a little click there. And I mean, I'll be foolish to think that it's not. So and those are 8 things. You see how they're all kind of related,
Yes, they're all connected. Yeah.
and those 8 things, when you combine them all, that is what makes up that medical system.
Wow.
Right, some people, the system's kind of rigged against me, what have you. Well, that's all that stuff is the system. So how do you actually break that down and try to change it?
How, you got to take back control of your health.
That is exactly what it is.
You have to take back control of your health, and you're the one who is in charge of your health, your body.
Yeah, so I think the biggest thing is what you said, take back control, because the system is giving you the illusion that when you're in it, that you are in control of your health.
No, you're not. What about those people who have children and they try to take control of their children's health. That's a deep one.
Well, like what we did for our kids, and like, oh no, you can't do that. No, you're gonna do that. You can't be here. Or even more nefarious is you say, no, we're not going to do this. And then they start putting all these different government agencies
Yes.
involved and say,
Yes.
no, this is like
Neglect.
abuse,
Yeah.
neglect.
Yeah,
Like,
because
hold
I've
up,
seen
what?
that. And I haven't seen it personally firsthand, but I've read of stories like that.
Yep. So you have, doctors telling you that what is best for you. You have the government agencies telling you what is best for you. But a lot of times what you do see too is people think they're in control, making their own decisions, but yet they say, oh, well, I'm not going to do anything that my insurance does not cover.
Ooh.
And I think the
You're in
intention,
control, all right.
I think the intention is because of financially speaking.
Right.
However, you just gave up all control of your decision-making process. Because you're essentially saying, hey, I'm going to do whatever they say I can do, even though it may not be the best for me, but they're going to cover it. So I'm paying for it anyway, so I'm going to take it.
Yeah. Yeah. That's like giving out free food at the office, knowing that you can't eat that or it's not good for you, but you're still going to eat it because it's free.
Yeah. And that's a big one. That's a big one itself. That insurance is not a platinum card.
It's,
Huge
people
principle.
need to be re-educated on that because we've been conditioned for so long to think that it is. That this is like having insurance means, oh, I can go to the doctor now and get my cure done. And it's like, well, hold on now.
Yeah.
You may not want that cure, but it's like, well, the thinking is a la carte. It's like, I'm not going to do that procedure because my insurance won't pay for it. Like you said.
Yeah, they won't pay for it. I'm not going to do it. But I got all these issues, and I got this platinum card. I'm going to lay it down, and they're going to just do whatever they want to do to get me healthy. But that doesn't make you healthy.
Wow.
Only you can make yourself healthy by taking back control of your own health. Be your best doctor. Right? That is what it comes down to, because you ultimately are the decision maker, and you know what's best for your body, and you have complete control.
What would you say to people who say, well, I'm not a doctor, so I don't know what I need to know?
That's an excuse.
That's an excuse you've been
there's
trained
so much. I mean, there's Google MD, which is terrible. However, that's a good way to start getting different ideas of different things that can happen. And now you say, okay, well, there's 4 or 5 different things that Google MD says I can do. Let me really, truly investigate now with more non-biased information to see what that even looks like. And so you start asking these questions, and you start going down these holes, and you're like, holy smokes.
Be careful.
Yeah. And ultimately, it all comes back to this, though. As you have more complete control, you start to realize that you can prevent many diseases and chronic illness by simple lifestyle, diet, and nutritional changes.
Yeah. Plain and simple.
It's very, very simple. And that's how you become your best doctor.
Yeah.
100%.
Yeah.
Ask the questions.
Yeah. Do your own research.
Yeah, I know. I hate that word too. That phrase. That they've ruined it.
Do your
Do your
own
own research. It means, oh well, I'm telling you what it is, and just do your own research. No. The research says you can reverse heart disease.
Yeah.
That's what it tells you.
Yeah.
You can do it.
You can reverse diabetes.
Yeah. You can prevent having dementia.
Yeah.
Like we talked about in our last episode.
Yeah.
You can prevent it. So don't stop asking questions. And ultimately, is stop doing things that make things worse. And what do I mean by that is stop going to a doctor when you are not truly sick and need a real true intervention. Like, I'm going to go to a doctor if I break my leg.
Right.
100%.
That's different. Yeah.
Yeah. I'm not going because I got a cough.
Right. I'm not going because then I got to go make sure everything is okay.
I'm not going for a preventative, because going to the doctor, I'm not preventing anything by going to the doctor. I'm preventing things because of how I live my life.
Right.
So I don't need a preventative visit.
Right.
I'm preaching. I'm sorry.
He is. He's passionate here. Like, I'm passionate about, eating healthy food. He's passionate about this.
Yeah. I want people to be in control and make smart, informed decisions, because at the end of the day, it's you who have to live with the decisions and the treatment, not the doctor, not the specialist, nobody else but you. And it's only a matter what you think. It's that powerful.
Yeah.
So listen, I talked a lot this time, but Let us know what you think.
Yeah. Leave a comment down below. Thank you for visiting and subscribing.
Yeah, and listen, if you want to know you're having some kind of health issue and you want to know what your optimal health score may be and what's really causing the root cause, what's causing your issue, look in the description below. There's a link to a free health assessment, which will tell you the most likely reason why you're experiencing what you're experiencing. It's awesome. It's one of the things that gives my clients, and I think you're gonna love it. So take a look at it.
Yeah. I find it very helpful.
It's pretty good, right?
Yeah.
It's fantastic.
So until next time, be well.
All right, take care.